Let's face it, there's a lot you don't know about sickle cell disease.
Like that it affects almost all races.
Like that it affects millions.
That it can be unbearable.
That it's the most common genetic blood disease in the country.
But awareness and understanding are still far too uncommon.
Let's face it, there's a lot you don't know about sickle cell disease.
And that's a disease too.
Call the 211 info line to learn more.
Welcome to another episode of Face Sickle Cell. My name is Virginia Pratiller. I am the Executive Director for Citizens for Quality Sickle Cell Care, and we welcome you today. We have a wonderful session today that we hope that you will stay with us and hear about some new exciting things that's going on with the medical field, and especially talk a little bit about what's happening with sickle cell disease. Today I have a guest with me that I'm excited about sharing him with you today, because I met him when I first started working with sickle cell disease, and he has played a critical and crucial role in the awareness of sickle cell here in Connecticut. And so we're going to be talking today about medical homes. It's a system of care. It's not a new concept, but it may be new to you. So we ask that you stay with us as we discuss medical homes and sickle cell disease. Dr. Roger Thrall, would you please give us an introduction of who you are and how you got involved with sickle cell disease?
Well, it's an interesting story because I'm a trained pulmonary immunologist. Started at the University of Connecticut Health Center about 35 years ago. I've grown old here in Connecticut. Actually, I'm from Hartford, Connecticut. Grew up here. I have a lot of grassroots in Connecticut. But so I was a professor. I am still a professor at the University of Connecticut Health Center, and a young lady, Victoria Odesina, who founded one of the sickle cell disease, Quality for Sickle Cell Care nonprofit, came up to me and said some of our patients are having pulmonary lung disease complications. And what was going on, and her and a Dr. Ledger, a nurse, approached me and said we need to do something about almost 15 years ago now, I believe. I said, I don't know much about sickle cell disease, but it sounds interesting, we should do something. And it's a beautiful story, because we met in a blizzard in February, sort of one of our storms we just recently had. And formulated a plan to do a needs assessment in Connecticut for sickle cell disease in response to a Department of Public Health initiative that they started. And that started us off, and we received the grant, and we've been continuously funded from the Connecticut Department of Public Health now for going on, I think, 10 years or so, to support our initiative, which was really to build a continuity of care, which is basically a comprehensive care for sickle cell disease statewide in Connecticut. And that falls under the definition of a medical home. It's very complex, and we can get into it, but so it got me, a pulmonologist, say, lung disease, into the sickle cell world. And I've been on a rapid learning curve for the last 10 years. Been very exciting. I think we've done some good things with the State Department of Public Health and with a lot of partners. So that's what got us going. And we're doing a lot of clinical work, obviously, with your groups, and for care coordination, and some basic science experiments, looking into the mechanism of different complications with sickle cell disease.
Well, that's been an interesting journey, and I'm just getting on this journey like 5 years ago. And it's been an interesting ride for me as well, because it's a learning curve, and there's so much to know about sickle cell that you know, I'm still learning and growing, and I'm sure that those who are living with it they're also learning and growing as they continue to struggle through this whole episode of living with sickle cell disease. So I think that what we could talk about today is the medical homes, a system of health care, because although it's a new concept, it was a new concept for me when I heard about it, and although it's been around for a long time, I think that a lot of people may not have an understanding of what a medical home is. Would you give us a definition of what a medical home is? Yeah,
that's not a simple one. It's pretty simple, but a little convoluted. I like thinking of a medical home, and when I give talks on it, I define it in the term, very simplistic term. I associate it with one of my family's most favorite movies, The Wizard of Oz, and Dorothy saying, "There's no place like home." And that is the truth. Probably most of us would agree there's no place like home, and sometimes the family moves and it goes from one building to another, but home is home. And we need to think of healthcare. The whole medical home initiative is that you should feel comfortable in your healthcare system, with your doctors, with your support staff, just like you would at home. So I think the backbone of it is that the patient and the family member should feel comfortable in their medical home, their healthcare providers, and should be active partners, just like you are in the family. You should be an active participant into your healthcare plan, agree with the physicians, understand the decisions that are being made, and so in a nutshell, that's it. It's not necessarily one building. More often than not, it's not going to be one building, because anyone with a complex disease, a long-term disease like sickle cell disease, and it's not unique to sickle cell, people with spina bifida, muscular dystrophy, a multitude of long-term diseases, lifetime diseases, are constantly, it's more important for them because their care is so medically complex. My other appointment is with Hospital for Special Care, which is a long-term care hospital, and they really practice medical home. It's care coordination for the lifetime. Think of it for the lifetime. You're in it, and they do a superb job. It's just fine-tuning this medical home term and using it. And I like to see, in the backbone of that is that the patient has to be an active participant. Actually, the term now that's being used is a patient-centered medical home, PCMH. So it's not just a medical home now. The term is patient-centered to emphasize that patient has to be in the center of the spoke of wheels of all the players of your healthcare team.
That makes sense. What type of services would one expect through a medical home?
Primary care, it starts with primary care. You need a primary care physician. Even though with sickle cell and muscular dystrophy, you'll have your specialty physicians because of the specific disease, but it all starts with the primary care physician. They're better at care coordination, the whole thing. With sickle cell, as you know, we have 2 pediatric specialized comprehensive centers in Connecticut Children's Hospital and Yale New Haven's Children's Hospital. So we have these really comprehensive, great sickle cell specialty centers. But again, that's part of your medical home. And while you're a child, let's say, you're in this medical home content or part of the medical home. So that comprehensive center does an awful lot while you're in pediatric care. Important component of it is to transition to adult care. So that still you have to sort of say you're still within your medical home You're just transitioning from the pediatrician's care to adult care. It's still your comfort zone.
Yes.
And we have programs, and I know you're part of an active program of transitioning the kids at Children's Hospital to the Yukon Health Center for their adult care. So you're still within this medical home, healthcare system. So it's comprehensive, it's coordinated. Another key word is there's a coordinator to help you coordinate. We like to say that you have a care coordinator. That may be your contact person. You have a navigator to help you navigate the system of all the services you need, because the demands of the services are great and change with age. So it's, again, not just one site, it's multiple sites.
Multiple sites.
At school, the care coordinator may go to the school system with you to negotiate an independent healthcare plan, school system plan.
Yes.
What are the needs? 509 probably for most of the sickle cell kids. It's called the 509, or an IEP, independent educational plan. So it's multifactorial. It gets into community-based services like your organization, CQSCC. Really important roles for the nonprofits.
And would you say that these systems, or the system, should be transparent or, seamless?
Absolutely seamless. Yeah, you're not leaving a home because you change hospitals, or even if you move, you're still the PCP. Can it may be you go into another group somewhere, but the PCP, your medical records, your healthcare plan will transition, but it should absolutely be seamless. So you're not leaving the home. You may be going to a different site, you may be going to a different hospital, but again, you're comfortable, you know it, it's not going to be something unexpected.
So how would I, if I was looking for a medical home, how would I know if my doctor, my current PCP, was a part of a medical home?
You could ask. Mostly in Connecticut now, a lot of them, there's a certification program, a national quality control, let's say, for being certified from the federal government that you're a medical home. That most of our community health centers now have passed that. There's a website, and I can give you the site. I think you know the site, and it lists. And I think there's, last time I printed it out, there was like 700 sites. Most of them are these medical community health centers. So you can ask. They should approach you, but I would ask if you don't know, because that would, if you don't know, then it kind of infers you may not be actively engaged as much as you should. You should have more access to your medical records, especially with computers and electronic medical health records now. Part of it is that, again, you are actively in control and engaged in your healthcare system. So you can ask. If they're not, they're probably trying to be, at least, especially at the PCP level, at the primary care physician level. They're all trying to fulfill the requirements, which are making sure that the subject, the patient, is actively engaged in all decisions being made and in agreement. So you are creating what we call a healthcare plan. Here's your plan. Here's what you're going to do when your child is 5, 6, 7 years old. They're changing schools. Let's get ready to change schools. It's proactive rather than reactive, that you're sick and in a crisis. It's proactive, that you're being prepared, and when a crisis hits, you know where to go, who to call. We have arrangements even with the emergency departments now for triaging patients, quicker service and more directed service for sickle cell disease. So, but you need, again, to be proactive. Self-advocate is the word you may hear, is self-advocacy. Actually, I know your group, the QSCC, has educational programs to educate the family members of how to be proactive.
Yes.
Understand your disease, understand your child's conditions, and how to interact.
So transition is actually something that's happening all the time, you know, from infancy to toddler, you know, so parents really need to be involved all the way through.
Yes.
I know as young people become young adults, parents somewhat take a step back and let them do the advocating for themselves. Do you think that parents should stay involved to a point, to a degree, until that transition is firm?
Absolutely. I think you said it well. Again, that should be a slow process for the child, but it is important for that child to become a self-advocate.
Yes.
And some children will do it at a younger age than others. I wouldn't force anybody into it. You as the parent want to keep an active role and just support the child until you feel very comfortable that they can. We see a lot of the teenagers, and you have a lot of programs for them, and some are great self-advocates, some develop a little slower, and that's fine. You as the parent can make that determination, when do I really back off? But it's important to let that happen, especially after high school. So that, you know, if they're moving on to college or technical school or a job, you may lose a little more contact with them, that they need to be, they can call you up for support, but they may be having to make some decisions.
Well, let's end here and come back and do the second segment of our discussion, talking about advocacy and how people can get involved in a medical home if they're not already.
Sounds good.
So thank you so much for this beginning discussion. This is great information.
Okay.
We'll be back in just a moment. Please stay with us while we take a little intermission. Thank you.
I'm Paul Willis, and I host the program, The Grassroots Business Journal, on accesstv.org. If you ever thought about being a business owner, crave that entrepreneur spirit or mindset, but don't know what it takes to get started, or lack the resources or have no idea where to start the process, tune in to the Grassroots Business Journal, where you will hear from business owners, state agencies, and nonprofit organizations, all of whom will inform you, guide you, educate, inspire, or motivate you to taking that next step into business ownership if you so choose. Or maybe you just want to hear good business sense, or get your business out there in your community, or better yet, the World Wide Web. To take your business to the next level, all of these and other concerns are discussed by small business owners themselves, whether startups or established business owners, community leaders, or political leaders. It's where small businesses get their chance to advertise themselves, where talking business is linked to social media. So tune in, listen, and see who is talking business from your community on the Grassroots Business Journal on accesstv.org. Any comments are welcomed by email at pcwillis@gmail.com.
Welcome back to another second segment of our discussion on medical home and sickle cell disease. I am here with my guest, Dr. Roger Thrall, and we've been having a great conversation, which we would love to include you in on. So we're going to continue the conversation that we were having earlier so that you can hear more about medical homes and sickle cell disease. So Dr. Thrall, we were talking about advocacy and how advocacy is a very important piece of the system of healthcare. Let's discuss what has happened prior to our current situation and system, how we got to this place, how people were involved, what were the efforts that went out into the community to get people to, you know, galvanize around this whole idea of medical home and the care of our clients.
Yeah, and I think, as we said earlier, what spearheaded the state Department of Public Health did provide us with a grant for the last multiple years. And part of the grant was to do a needs assessment, and when we polled all the patients and families, we had a survey, and we polled all the physicians throughout the state, and we got our responses back, and we found out there was big educational needs with both parties, both the healthcare providers in Connecticut and with the consumers, and we actively engaged educational programs. A lot of physicians, Dr. Andemariam, Dr. Borchak, Dr. Hagstrom, to name a few. We went all throughout the state of Connecticut educating the healthcare providers, doctors, nurses, social workers at all the hospitals in Connecticut, most of the community health centers. Everybody wanted more information, more education, because sickle cell disease is very complex. So even from the physician side to the nurse's side, they needed education. So we actively engaged them. We also had programs to actively engage the public, the consumers, the patients, especially through the nonprofit organizations have been a huge help. CQSCC was a huge help. Southern Sickle Cell Association in the southern part of the state with Dolores, William Edwards, terrific help. So that was our outreach to the communities, to the patients. To self-advocate, you have to understand your condition. You have to understand the illness, what options you have. And I would say this very freely, I've been being educated on sickle cell disease for at least 10 years, and I'm learning something every day. Every time I talk to a patient, everybody has a different experience. Everybody doesn't react the same to the same therapies. So it's a very complex disease. And for parents, or you make a decision about your own health care as a patient, you have to understand what options you have, understand your disease. So, you know, inherent in this medical home, the major concepts are to have both parties, the medical team versus the family team. And even the family, when I say that, it's the siblings as well as the patient, as well as the parents, guardians, need to be educated how to help, how to understand, to make a nice medical home, to make a nice personal home, and meld those together. Absolutely essential. So education.
Education. So how does one learn to become an advocate?
Yeah, some people have personalities that like to speak up. It is hard. It's hard to learn. It's hard to be a true self-advocate. But it begins with educating, understanding where the physicians are coming from, and the nurses. So what are their expectations? What do you need to do? There's a lot of support. We work closely with both the comprehensive pediatric centers at Yale and Connecticut Children's Hospital in Hartford, as well as the adult centers. And they all have support groups. I would advise any patient and their families to go to support group meetings. The two nonprofits, your organization and Dolores is down in New Haven and Bridgeport, so we have the state covered, really offer a lot of educational programs. I think it's essential. Spend as much time educating yourself. And the more so, if you're never going to have all the answers and a full understanding, but no matter what, you should feel comfortable to go and approach any of the healthcare team with questions. Ask them questions, ask your group questions. The nonprofit organizations for sickle cell in the state are active team members in our grant covers the whole state, and we couldn't be where we're at without the two nonprofit organizations and all the partners working together.
Absolutely.
And it's a unified effort.
Yes, it is. And you know, I just want to do a point of clarification because Dolores Edwards-Williams down in the southern part, we have a discussion about the nonprofit organization versus the foundation. We're beginning to understand that a lot of people are thinking we're a foundation as opposed to a community-based organization. And so we do advocacy, support, help, you know, navigation through systems, and but we're finding that there's a miseducation there
about your
that
role.
in terms of what we offer, what we have available for our clients, and we basically do a lot of referral out because people need help with employment, they need help with health services, you know, they need help with education and all those aspects where they need to be advocating for themselves and all of those different situations. I think the other piece that we're finding is the engagement piece of the consumers. How do we get people to get more engaged into what we're trying to do in terms of educating and bringing awareness?
I think it goes directly to feeling comfortable, whether it's with the healthcare team or with the nonprofits. And even to clarify your point a little bit more, we actually, the grant helps fund self-advocacy through your two nonprofits.
Absolutely.
That's your role on our grant, is to be the patient advocate. And I know yourself goes to the transition clinic. And is active part of the transition team at CCMC. So the patient, again, has to feel comfortable, has to trust. You trust your family. We have to trust the team. You're part of the team, the nonprofits. You know, I knew nothing about the two nonprofits in the state of Connecticut when I started. We've come together tremendously over the years. We've taught each other so much, it's incredible.
Absolutely.
And it's been beneficial. We've seen it. We've used that, gone into the ED departments, the emergency departments, and made resolutions that the state has approved of how the patients with sickle cell disease are to be treated in every emergency department in the state of Connecticut. And the two nonprofits were instrumental in making those guidelines. Couldn't be done without it. And the whole healthcare team, physicians and everybody joined forces. And the parents and children. We have some great teenagers with sickle cell disease have spoken out in front of the legislative office building, in front of our legislators, and self-advocated, and that's powerful.
And I think that's the piece that I really want to, in this year, begin to really build on, the advocating for oneself. Teaching people how to navigate the systems themselves, so that if you know, God forbid, anything happens to a nonprofit organization, you still have the skills to navigate through for yourself. And I think that has to start at a very young age in terms of the advocacy. I am always impressed when we go for transition clinic, how the young people know what medications they're on, what dose they're taking. And to me, that right there is education in and of itself, because when you sit in front of a physician and you tell them with the name of the medication that you're taking and how much doses you are taking of that medication, that's impressive to me.
No, it is. And
That's
you're absolutely
impressive.
right. I may be, it gives me comfort to see our children over the years gain that ability. And I think it is the whole healthcare team. Even from the nurses in the clinics working together with the nonprofits was a nice step and a big step at the time, 10 years ago or so. It wasn't done, and it still isn't done in a lot of different disease groups and clinics. So we have to take advantage of that education, and build it as a culture. It's part of the medical home. and build it into our children at a young age. And it doesn't have to be an aggressive self-advocacy. It's an intelligent self-advocacy. This is what I need. And for the children, even to the parents, to say, you know, I don't feel good on this medication.
Yes.
Or I'm not feeling good whether they're on medication or not. So as an early warning sign that there may be something, we maybe call up our doc or the office and see if I should come in because my child. So we need to be good listeners to our children, teach them when to say, you know, worry about this or not, or if something's different. Just if something's different, whether it's a new medication or they're just feeling different. That's important. So it is self-advocacy, engagement, comfort again, you know, with your friends. Think of your healthcare team as friends. And they are. We know them all. We've worked with them for 10 years now, and I can honestly say across the state of Connecticut, from community health centers, we've been impressed. They want to be taught. We had to teach them. EDs from the emergency departments to the community health centers, they're all open. And,
you know, one piece I want to touch on real briefly is the whole idea of research and clinical trials and how it's important for people living with sickle cell disease or caregivers to really become involved in the research and the clinical. Could you just talk about that just briefly?
I can cite one clinical study that we're doing. Dr. Andemariam is the principal investigator at UConn, and some of the studies we did in our basic science lab on a mouse model of sickle cell disease, it demonstrates the importance of being vaccinated and the complications of sickle cell disease in terms of vaccinations. And they are actively engaged in vaccination study, pre and post flu vaccines now. So it does give us, with sickle cell patients with sickle cell disease, understanding their protection from a vaccine, and it's complicated. So we're actively engaged. It is important. I don't want to, some of the studies are, some people like to volunteer for clinical trials. They're there, and they've been approved. When we do a clinical trial, it's approved by everybody. You know, and the patients are certainly, their safety is of most importance, is the safety of the patient. And so they're important. We're excited about some of our basic science. We have some grants, and it's more grants coming and plenty of publications. So it's an exciting time. There's a lot of progress being made. A lot of state support for sickle cell right now, and it couldn't be done without the nonprofits and the patients. I tell you that very sincerely. Without the patients that have come forward, self-advocated, the nonprofit associations, the politicians, they listen to you more than they do me, and they should. And it's a critical role.
Well, we are coming down on the end of our discussion. This is a great discussion. I would love to have you come back so we can expound on some more information that you would be able to give to us. But as we close out, I would like to just ask you one question. If you could do anything on behalf of helping the sickle cell movement, if there was one thing that you could offer, what would that be?
I think you used the term engagement. The patients and their families need to be engaged in their health care. They need to be engaged, actively engaged. Take control. Take control with who you feel comfortable with. It could be the nonprofits like yourself. I can guarantee you, Virginia and everybody in the nonprofits is very approachable. Engage them. They have a lot of great activities. Get educated. Get educated, and they're easy to do. It's actually hard to do, but easy to accomplish, I think.
Thank you very much. That was great. I appreciate that. Thank you so much. You have just heard another episode of Face Sickle Cell with Dr. Roger Thrall and myself, Virginia Patiller, serving as Executive Director for Citizens for Quality Sickle Cell Care. If you would love to make contact with us, we're at www.cqscc.org, or you can call our main number, 860-223-7222. Thank you so much for being with us today. It was a great day. Thank you.